Dr. Alex here with Dr. Skip, who practices in Green Bay, Wisconsin. As you guys know, my mission, sole mission for right now, is to bring the awareness to why chiropractic needs to be the first thing parents turn to when you are expanding family, when a child might be having some issues. And so I am reaching out to my colleagues in the chiropractic field who have been practicing for a long time, who have seen what we call these miracles, right, of kids being taken off medications, of flourishing in athletic performances, and so on and so forth. And we as chiropractors, as doctors, we know that's just how the physiology is supposed to work. So I wanted Dr. Skip to kind of talk a little bit about his experience in practice and what that really looks like. I know that Dr. Skip here has been adjusted himself since he was 2 years of age.
Yep.
So I know that this is in his blood, in his breath. I mean, everywhere around him. Like I said, he has a practice in Green Bay, Wisconsin, and he shares it with his wife, Julie. So take it away, Dr. Skip. Why is chiropractic the last thing people turn to, but it should be the first?
Yeah, that's an awesome question, Dr. Alex. And Dr. Alex, I just got to tell you, thank you so much for having me on and talking to your wonderful community down there. And you're so well versed in us already. That's so great. Thank you. Thank you. It really means a lot. I think most commonly from a parent's perspective, we think of chiropractic last because we always think of chiropractic as to fix and or cure an ailment. And when we think about children and they think about their first birth, like their firstborn child, they don't necessarily have anything wrong per se, symptomatology, okay, symptomologically, they don't think of things right away. So it's not a back pain, it's not a headache, it's not joint pain. Chiropractic couldn't be farther from that. It's about brain-based communication and full function of your baby's nervous system. Now, that being said, in chiropractic, it's brain. Your brain is what controls your body top to bottom, inside to out. And with a baby during development, did you know from a parent's perspective, a lot of us didn't even know this, your nervous system is fully talking to itself at 20 days into conception. 20 days, moms. So think about that. 20 days after that little baby just starts in you, its nervous system is already online. It's already putting itself together. And then for the next 38 weeks, the 37 to 38 weeks, maybe 39 weeks, that nervous system is fully talking to that body and 100% communicating to every nook, cranny, and cell and running every program in that body. So do you think that communication is absolutely so important? It's 100% imperative, right? Well, what happens if we start getting miscommunication? And all of a sudden, a baby knows how to breastfeed at 20 weeks in you, mom. So it's learning how to suck its thumb and suck on its hands at 20 weeks in you. And then when it's born, all of a sudden it's forgot its program to learn how to breastfeed. So what happened between that 20-week period in you when you get your first ultrasound, hopefully it's your one and only, and then at 40 weeks when that baby's born, it all of a sudden forgot how to breastfeed. That's not okay. That's an inborn, inherent programmed pattern. It needs to be there. What disrupted that pattern? Most of the time, 9 times out of 10, the birth process is what interrupted that pattern. Misaligned and subluxated the spine. Now, chiropractors use that word subluxation. This is really key. Everybody outside of chiropractic will call that a bone misalignment. There's so much more to that term and what it means, and we're not going to go all the way down that vernacular and go into that. But I want you to think of it as balance versus imbalance. And when we get a malposition or a subluxation of that first vertebra in the neck, we get a misalignment, it immediately causes imbalance between the body talking to the brain and the brain talking to the body. And now we start this massive myriad of malfunction. Whereas parents, what we need to look at is, can baby turn their head in the right direction? Can they latch properly? Can they actually stay on breast? Every baby should be able to breastfeed. They've been neurologically programmed and inherently meant to breastfeed. So why did they all of a sudden forget that program? Why do they favor one breast over the other? Mamas, it's not because you have more breast milk production on one side versus the other. Remember, your body's meant to be completely symmetrical. So if it's not, and we see asymmetry and imbalance, now we know that nervous system isn't working correctly in that little baby. So we need to look at it from that perspective. I know that that was a long answer,
No,
but
that
we've
was
been
a
in.
beautiful answer. That was a beautiful answer, and I'm just so in awe of your mission and your passion and the way you talk about this, your drive. So that is
Oh,
amazing.
thanks.
So I'm so glad that I'm able to share this with my community as well as yours, because I'm sure people
Yeah.
in your community will see this as well.
Oh yeah,
Uh,
we'll share it like crazy.
Absolutely. Dr. Skip, how long have you been in practice?
I've been in practice for 13 years.
13
Um,
years.
yep, I graduated in 2008, and we started our practice in August of 2008. So
Awesome.
we jumped into it immediately.
Absolutely. Yes, same here. So talk to me a little bit about the most recent miracle that you have seen in your office. What transpired there? What happened?
Oh wow! So I'll tell you the most recent one that sticks out. We see new babies every day. We see lots of colic. We see lots of kids with digestive issues. We see lots of constipation. We see a lot of that. But I'll tell you, the most recent little guy that came in, and I see teenagers too. And I wanted to tell you right away about Gabrielle. She's 13 and has had ear infections for 13 years. And she's actually had 94 ear infections since she's been under care, since we actually started getting the balance back to her immune system and her nervous system. They work one to one. Those ear infections completely went away. And we never treated the ear infection. That's not the job. Our job is to get the body communicating properly. And then the body actually starts taking care of itself. Imagine that the body actually heals like it's supposed to, instead of just constantly compensates and gives us just crappy health, which it's trying to actually compensate. But let's talk about this little guy, Soren. Soren's amazing. So I started seeing Soren. He's 3 years old, okay? And Soren, oh, correct that. Soren's 2.5, sorry. And Soren hasn't been able to poop for the last year. Like literally, he goes on average, it was 21 to 22 days between bowel movements.
Woo!
Yeah.
I'm
Yeah.
constipated just thinking about it.
Yeah, right. That's it. Oh man, if I can't go for more than one day, I'm not happy. So this little guy, and the thing is that he couldn't go to the bathroom. It's constipation, but it's chronic constipation. And the parents have exhausted everything they can possibly go through medically. Tons of Miralax, different laxatives, anal suppositories, fleet enemas, whatever they could do to clear this little boy out. Because here's what's happened is he's all of a sudden started to develop really bad eczema and really, really bad skin conditions. And if we see skin conditions in little kids, we know that their body's toxic. And it's toxic because it's not getting food out. Or it's malnourished, which means it's getting food out too quickly, or it's not pulling nutrients across.
Right.
So we see this massive change in bowel. And I think you'll know where I'm going to go with this. But literally, Soren started care 9 weeks ago. Within his first week of getting adjusted, he started pooping. And then within his first 15 days, which is roughly in this office, that would have been 7 visits, he actually started pooping on its own. And he's been pooping on his own ever since. And he's going every day now. And his skin is completely cleared out. His eczema has completely went away. He has no more dry skin. He has 0 peeling. He's happy. He's healthy. He does not have toilet aversion because he's learning how to potty train now. And these are some of the cool miracles because mom, here's the thing about mom, and bless her so much. She works in the medical field and she's a nurse in an OR. And she looked at me 6 weeks into care and she's like, I don't care what anybody says. I believe in chiropractic. I'm a believer. And the funny thing is to me is when I have patients tell me that, I love it that they tell me that. I hold a lot of space for it and it means a lot because we got another win for what we do, right? But chiropractic's not a belief system. Chiropractic is not, I hope it works. Chiropractic is like gravity. Whether you believe it or not, it's a systematic way to get the body back to actually healing like it's supposed to. The core to chiropractic is the body is designed to heal itself. And why, when it doesn't heal, there is imbalance and malfunction. 100%.
Absolutely.
100%. And whether you try to go in and try to change that imbalance nutritionally, you try to change it through changing energy patterns in the body with different types of therapies and acupuncture and Reiki. Bottom line is we need to get balance back. And the one thing that will always, always, always balance the body is proper communication to the brain.
Absolutely. Amen to that, Dr. Skip. That was beautifully said. That was beautifully said. So I have some training just like yourself in, of course, taking care of the pediatric population, right?
Mhm.
So one of the things that I have recently heard from few moms is, well, my baby, the conception is that if it's not broken, let's not fix it, right? But we know that certain things compromise the function of the nervous system, right? They're
Yep.
called these stressors, and they come in multiple forms: physical, emotional, and chemical. So, when is a good time to get your nervous system checked, Dr. Skip?
I would say within the first hours of being born, if you can. And um, the nervous system needs to be checked. And the funny thing is in hospitals, the kid sees their pediatrician within their first few hours of life, gets all of their 10 fingers and toes counted, checks them for their basic reflexes, weight, length, head circumference, if they're breathing, checks their heart. My question is nobody tests their nervous system. And the only people with the proper education on this planet to properly check for function of the nervous system are chiropractors. So in my mind, it's inherent that every child should be checked.
Absolutely.
And every human on the planet should be checked. So it's not whether a timing issue as it is, you need to be checked and you need to have your children looked at. Absolutely. It doesn't necessarily mean that they have to be adjusted. But as from a parent's perspective, I would want to be aware if there was malfunction in my child's spine or in their body at some point. And then I make the actual conscious decision from a parent's perspective, whether or not I choose to have my child looked at, adjusted, and allow their body back to full communication. But it's a choice.
Absolutely.
But every parent should be given the choice, but every parent should have the opportunity to immediately have their child checked. And unfortunately, they don't, because nothing gets told to them or actually gets actually shown to them the abilities of what the body can do and how it's actually inherently set in that they're designed to heal and work with themselves. Does that make sense?
Absolutely. So, Dr. Skip, you have been in practice much longer than I have. So, even to this day, I still hear people say, well, my pediatrician told me chiropractors cannot help with anything. That is true, that we do not treat anything per se.
Yep.
We are again there to optimize the function of the nervous system. But what is your response to parents watching this when they say your pediatrician told you you shouldn't go to a chiropractor? What is your a message to the parents? I mean, from my perspective, it's, well, they have a very limited knowledge of what I do. And
Yep.
therefore, again, it's not their place to decide that for you. It's for you to experience it yourself and to
Yep.
kind of dig in a little deeper. But what do you tell to parents who are, again, trusting their medical profession to give them the direction of where they need to go and what type of team they need to build around them? And perhaps this integral part of chiropractic care is being left out.
So here's where I start with that first. A lot of the times when my parents start seeing what we see in the office and we walk them through our exam process and we show them what's going on with their child, there's a couple things that happens. Either they get disbelief and saddened, or they get angry, mad, and sad, or they get very, very frustrated and they don't know what to say. And that alarms me, and I feel bad for the parent. But here's the thing. I never show anger for the pediatrician because I have to have space for what they've been taught and what they've chosen to increase their education by. Whether they've taken special courses, whether they've had a colleague or somebody say to them, you know what, that chiropractor hurt that baby, or that chiropractor did that. And the thing is that to understand where the pediatrician is coming from first, because they're looking at diagnosis and prevention of disease, or how do they actually fix a symptom. Where chiropractic looks at it from a functional aspect of, is your baby, to be honest with you, is your baby working or not working, period? Is that computer that's running their body actually communicating and causing the body to work? No one can check for that but me, but you, Dr. Alex. Especially the ones like us that are certified in kids that have had extensive training. We've had extensive training, more than most people would even wrap their heads around. We're talking 400 to 600 hours of continuing education and constantly testing and constantly working in different programs. But with the pediatrician, you have to come from an area, okay, this is what they're thinking here. Now, from a parent's perspective, I would never tell a parent that their pediatrician is wrong. The reason why is because I don't ever want the parent to feel like the decision they took on to trust that pediatrician was a bad move, which immediately which will immediately make me as a parent feel like I was an idiot, which is not the case. You only know what you know, and you don't know what you don't know. So my job then is to show the parent exactly what's going on, show them what the pediatrician would have seen, and then where we see the changes, where we differ in our philosophy of the body's salutogenic model of its ability to heal itself, or it's just a bunch of bone and tissue that gives us symptoms, and all we have to do is change the symptom and it's healthy, which couldn't be farther from the truth. So that's where we come about that a little bit differently. And once the parent, as a parent, once we actually are able to see and understand what's going on with our child, it makes our decision making a hell of a lot easier. And it gives us a lot more trust because we actually know what's going on with our child. The biggest thing I get back from my parents is I've never had anybody explain to me what's actually working and not working in my baby, why that malfunction is there, and what needs to be done to fix it. And I've never had anybody show me an exam. They just assume, and that's what we do different in chiropractic.
Awesome. Fantastic. I know you are tight on time, so any last few parting words for anybody watching this, in particular parents?
Well, I'll tell you what, all of you that are out there listening right now, and if you're around Dr. Alex and you get a chance to meet her, get a chance to see her, get a chance to actually have her take care of you or your children, there's no one that I would trust more than her. And in my mind and in my line of work and what we do, and in the pediatric chiropractic world, we run a very, very close network, and we know each other very, very well. And we need to be able to trust one another back and forth. And to be honest with you, if you have any shed of doubt in your mind, if you have that small inkling in the back of your mind that you maybe should get your baby checked, or maybe you should have your spine looked at too, you absolutely need to do it, because that is your subconscious nervous system telling you you need to be checked. So if you have those feelings, you need to get it done. And there's plenty of us out there that will happily find you a person. If somebody's hearing this is not in our areas, we will find you the right person to go get your spine checked by.
Absolutely. Wonderful. Thank you, Dr. Skip. I really appreciate those kind words. And if you are in Green Bay, Wisconsin, you know who to look up and take your spine to and enhance your expression of life. Thank you so much. I appreciate you carving a few minutes for my interview with you, and always all the best, and I'll talk to you soon.
Oh, that was awesome. Take care, Dr. Alex.
You too.